Hello, I'm Cordelia. I'm a trainee nurse associate. I've just recently started the course, and my base unit is the emergency department. The TNA course is a 2-year course, foundation degree course, where it bridges the gap between the CSW and the nurse. I've worked previously on A&E as a technician, and I've just got onto this course, which needs you to obviously have your maths and English. We have 1 day of university, a half a day of placement on different base wards, so you get to experience different areas and work with different specialities just to get an idea of what you'd like to do. You get lots of support when you're doing the course from the education team, from your team of course that you work with, and other nurses. It's a great way of becoming a nurse, or if you want to be, you could always stop at being a nurse associate. So I've always wanted to become a nurse, but obviously because of different circumstances, I wasn't able to go directly into being a nurse. The good part about being a nursing apprentice is you get paid while working and learning. So you're learning on the job, you're studying on the job. So that made it easier for me. I know a lot of people ask, oh, why didn't you just go directly into nursing? It could have been a way, but I feel I'm getting a lot more from doing this, and also it fits in with my lifestyle. With the education part, you've got essays to write, you've got presentations. On the shop floor, you're learning different skills. You're working with the nurses, you're working with the CSWs. So you're developing on different skills of how to care for patients, showing compassion. You're just basically developing your human skills of becoming a future nurse. The best part is helping people and also meeting different people, meeting people from different walks of life. You've got your patients, you've got your colleagues with various experience, both life experience, work experience. So we're continuously sharing those. I'll definitely say, look into becoming a nurse apprentice. It's one of the best ways of getting into nursing, and also deciding which area you'd like to work in. You get lots of support both from the hospital and the university, and you get paid as you learn. You get to help people as well. There's no better way of being satisfied than looking after people. Hello, I'm Cordillia. You met me as a TNA. I'm now a qualified nurse associate, and I'm so excited. I've received my PIN, and it means more responsibility. I'm back working in A&E permanently, and they've given me more responsibility in my role. I'm thinking more about what I'm doing, and I'm looking after patients, so I'm looking after my own patient load, with the support and supervision of the nurse. But I'm working more independently and providing care. Well, nothing really prepares you for becoming qualified. I was really excited, but obviously nervous at the same time. It's having that responsibility and knowing that actually you're looking after patients, and you need to think about all the things that you've been learning for the past 2 years, putting them together, taking responsibility for other junior members of staff, and also helping them develop. But I'm really excited. I'm looking forward to being a nurse associate. We've all graduated. Some have gone to different areas. Some are still in their base areas, but we're all doing our best. We're very excited to be in our new role. I mean, as you know, this role hasn't been there for a long time. But not only that, our teams really appreciate the work and the support we're giving them at the moment. And also just encouraging others who were technicians like I was when I started, to get back onto the nurse associate apprenticeship route of doing things. We need nurses, and there's no better way. Your team knows you, they've seen us doing it, so everyone's very excited about it. As you know, and I think I explained it in my first video, there has been plenty of support from their team. When we finished, everyone was very excited, embraced the role, and they're continuing to support me through my journey as I work as a nurse associate, and also how they encouraging me to build up and develop as a nurse associate while I work. So my future plan at the moment, I'm already waiting and looking forward to becoming, doing the nurse apprenticeship route. So I'm just waiting for the route to become available to me, and I'll be sure to apply. A nurse apprenticeship, which is a 19-month top-up to become a nurse. So this can be done either after you've done your nurse associate route, or there's a 4-year one where you can go straight into becoming a nurse apprenticeship to become a fully fledged nurse. Hello, my name is Cordillia. I'm now on my nurse top-up, which I started this year in January. It's a 19-month course, and some of you might have met me along my journey when I started as a TNA. I became a nurse associate, and I'm now on my way to becoming a fully qualified nurse. It's been a very exciting journey. Worked for a year as a nurse associate, as a registrant, developing my skills that I'd learned as a trainee nurse associate. The apprenticeship route is the same. You get parts being in university and part being on placements. So the education goes on. I have different placement areas where I get to learn and develop everything I've had to learn as a TNA, as a nurse associate, and now to become a nurse. A nurse plans care, whereas as a nurse associate, we're implementing care. Now I'm able to synthesize everything. Before, as a trainee nurse associate and as a nurse associate, you were developing skills, but now I know and understand why I do things. I'm able to also guide and direct junior members of staff, but I'm now working at a higher level, obviously with a lot more understanding of how you look after patients and provide good care for them. Where nursing takes me, I've got so many more choices now. By the time I finish, there'll be a lot of variety, but my main goal right now is to become a qualified nurse, to be able to make a difference in an area where there's so many shortages, and will be well appreciated and make a big difference. I'd really love for lots of students to become nurses, to take the route, particularly the apprenticeship route. As I walk through the hospital, a lot of staff are always saying hello to me. That's because they see me through the whole journey. They ask me in different areas what I'm doing there, and I tell them what I'm doing. Also, it's just a better way of doing things. You get paid as you learn, as you work, and you gain that knowledge and confidence that maybe going into the course directly, you wouldn't really have the opportunity to develop.